Hello, my name is Alexis Ross, and this is my informative speech. So, are you someone who does not believe in anxiety and anxiety disorders? May sound odd, but there are people out there who do not believe in it. Believe that they are real or that it's a serious issue in our society. So, anxiety will be discussed, and more specifically, the types of anxiety disorders, symptoms, and treatments. And anxiety has many different forms and cannot be easily cured, but there are ways that patients can learn to manage it and different treatment options that can be used to help manage it. There are many different causes and side effects to anxiety and their treatments, though. So, now, there are different types of anxiety disorders that most people fall into, and it helps to understand anxiety as a whole if you know about the different disorders. So, according to Mayo Clinic, according to the Mayo Foundation for Medical Education and Research, examples of anxiety disorders include generalized anxiety disorder, social anxiety disorder, or social phobia, and specific phobias. There's different ones other than just social phobia, and separation anxiety disorder. And so some of these may sound like they're easy to understand and diagnose, but they're not always exactly what they sound like. For example, the generalized anxiety disorder is different from what you may think. So according to the National Alliance on Mental Health, generalized anxiety disorder, or GAD as it's more known as, states that GAD produces chronic, exaggerated worrying about everyday life. This worrying can consume hours each day, making it hard to concentrate or finish daily tasks. A person with GAD may become exhausted by worrying and experience headaches, tension, or nausea. So these are things that someone may think they're coming down sick or things like that, but in reality they just don't know that they have anxiety. And another common anxiety disorder that the National Alliance on Mental Health talked about is the social anxiety disorder. So this disorder intenses fear about social interaction, often driven by irrational worries about humiliation. So, for example, they're worried they're going to say something stupid or that they're not going to know what to say. And someone with social anxiety disorder may not take part in the conversation. So they're probably not going to be those people who start the conversation. They're already worried about being in that atmosphere. And someone with social anxiety disorder, they probably won't contribute to class discussions or offer their ideas, and they may become isolated because of that. And panic attacks are a common reaction to anticipated or forced social interactions. So someone with anxiety may need to be aware of what exactly they're going to, like what event, and then they can prepare beforehand, and that will help them a lot. And the next thing I want to discuss is anxiety has many different symptoms or risk factors. So common anxiety signs and symptoms include feeling nervous, restless or tense, having a sense of impending danger, panic, or doom, having trouble sleeping, having difficulty controlling worry, feeling weak or tired. And that was also from the Mayo Clinic. And so these are all things that may seem small to someone at first, but sometimes it can come out later that it's caused from anxiety. And they can continue to have it day after day, and they may not ever know that it comes from anxiety. Also, according to the Mayo Foundation for Medical Education and Research, sometimes anxiety can be a side effect of certain medications. So, if you ever read your side effects on medications, anxiety or worrying or a fear, that can all be related to anxiety, and that can come from certain medications. Another huge cause that can make someone have extreme worry or anxiety is a drug and alcohol abuse. So drug or alcohol use or misuse or withdrawal can cause or worsen anxiety. That's also from the Mayo Clinic. Someone who's maybe trying to recover from a drug or alcohol use can be affected by this, especially if they relapse. So and that could be if they're taking medicines as well and they use drug and alcohol, that can worsen their anxiety and things like that. Another huge cause for someone to experience anxiety is through trauma that they have experienced. So children who endured abuse or trauma or witnessed traumatic events are at a higher risk of developing an anxiety disorder at some point in their life. That's also from the Mayo Clinic. So it's not just only older people or young teenagers or, all ages can experience anxiety, and they may not even know that they have it. The last thing I'd like to discuss is treatments and therapies that can vary to try to help with maintaining one's anxiety and make it a little bit easier to live through. So according to the U.S. Department of Health and Human Services, anxiety disorders are generally treated with psychotherapy, medication, or both. So anywhere from like counseling, things like that, like support groups and things, or they can use medication to help. Though these things do not cure the anxiety, even including medications. So these aren't cures for it. They just help maintain it. And along with treatment from doctors or psychiatrists, people who experience anxiety need help and need to be looked after by people who know them best. Taking new medication can be difficult because of the side effects. It can actually worsen the anxiety if it's not the right fit for that specific person. So according to the U.S. Department of Health and Human Services, in some cases, children, teenagers, and young adults 25 may experience an increase in suicidal thoughts or behavior when taking antidepressant medications, especially in the first few weeks after starting or when the dose is changed. Because of this, patients of all ages taking antidepressants should be watched closely, especially during the first few weeks of treatment. So like I said before, the medication could affect them negatively, and, a patient may not always be upfront about that, so that's why a family member or someone who knows them best needs to watch after them. So in conclusion, anxiety is a learning process for everyone who is involved, whether it is the patient or the patient's family or friends. As stated, there is no cure for anxiety disorders. There is not a cure. Lost my place. Anxiety has many different forms, causes, and treatment options. And anxiety is talked about completely throughout, providing examples of different disorders, causes or symptoms, and treatment options. These all connect because they give the full outlook of what anxiety is and what all comes with it. Anxiety affects not just one person of one age or one gender or one race or one ethnicity or one community. Anxiety affects many different people all across the world, regardless of their age, their gender, their race, their ethnicity, community they're part of. It doesn't matter. Not knowing all the information provided, or now knowing all the information provided, what will you do or say when anxiety is brought up or refuse to talk about in a public setting? Thank you.